Welcome to Session 3 of our Medical Transportation Training Program. This session focuses on the best methods to support your passengers. Session 3 topics include sensitivity towards older adults who are categorized under the American with Disabilities Act, special circumstances related to some transports, as well as offering the appropriate amount of light mobility assistance. Simply put, people with disabilities are people first. At the end of this session, you will be directed to an excellent video on disability sensitivity, which is part of this training. The following guidelines follow basic rules of customer service, starting with treating clients with disabilities with courtesy and respect. Giving clients with disabilities the same information and choices given to other clients. Never making assumptions about the client's physical or intellectual abilities. Asking clients if they need assistance before assuming they do. As well, any physical touch or close physical proximity should be initiated only with the client's permission. For example, ask for permission before reaching across the client to help fasten their seatbelt. Speaking directly to the client, not to their companion if they brought one. Speaking clearly with a normal tone and speed unless asked to do otherwise. If asked to repeat or write down what was said, doing so calmly and pleasantly. Being patient and allowing clients to take their time, responding in a pleasant manner. Here are some tips for communicating with clients who have hearing or vision loss, starting with hearing loss. Face the client when speaking, but not while driving. Speak in a normal voice. It's okay to speak slightly louder, but a raised voice distorts lip movements and makes lip reading difficult. Keep sentences short and simple. Minimize background noise by turning off music or podcasts and keeping the windows rolled up. For clients experiencing vision loss, identify yourself as their volunteer when you pick them up. Respond verbally when a client speaks to indicate that they were heard, instead of, say, nodding your head. And announce where you are when you reach the trip's destination. Older adults with visual impairments are at a higher risk for falls. Use verbal prompts to warn them of curbs or obstacles in their path, even when providing light assistance. The National Aging and Disabilities Transportation Center offers these dementia-friendly driver tips. A friendly face can help a person with dementia feel at ease if they are experiencing confusion. Create a comfortable environment by responding calmly to questions even when asked repeatedly. Reiterate to your passenger as often as necessary where you are taking them. Fear, overstimulation, or difficulty expressing thoughts can elevate stress levels. If your passenger appears frustrated, it is important to be patient, understanding, and sensitive to their needs. Maintaining eye contact, except when driving, of course, and using simple language can help mitigate your passengers' frustrations. SourcePoint's clients are expected to be free of contagion when being transported to appointments. Situations can happen, however, like someone feeling nauseous after a treatment or getting a cut. Use universal precautions anytime you have contact with blood or bodily fluids. Take no chances. Treat all blood or bodily fluids as if they are infectious. The SourcePoint provided first aid kit contains disposable gloves. Check them for rips or holes before wearing and replace them with new ones every 3 years. Even with glove use, it is important to thoroughly wash and/or disinfect your hands after removing and disposing of the gloves. To safely remove soiled gloves, pinch the first glove with your other gloved hand and pull the glove inside out and discard it. With your now bare hand, stick 2 fingers inside the edge of the remaining glove and pull it inside out until it comes free of your hand. Never reuse disposable gloves. Transporting clients to dialysis appointments is a common assignment. Both kidney failure and its treatment can wear a person out. On the way to the car, slow your walking pace to meet theirs and have patience. Clients may appreciate being offered a wheelchair ride to the car. Dialysis patients may have a fistula or graft in their arm as an entry port for the machine. Ask first before taking a client's arm, or, even better, offer your own arm for them to hang on to. The client may feel nauseous from the treatment. Go easy on the gas pedal on the drive home. The door-through-door transportation provided by our excellent volunteers is a level of customer service that makes this program one of a kind. Simply put, it means the volunteer accompanies the client from just inside of their home and back, and typically remains on site for the duration of the client's appointments. To qualify for volunteer transportation, the client must be able to get in and out of a car or chair with only light support. Here are the levels of light support a volunteer may offer. Remember to always ask before providing support. Gentle support includes opening doors and providing light verbal guidance. If considerable verbal guidance is necessary, please inform the volunteer supervisor. Watch how the client navigates getting into the car on her own while the volunteer provides assistance with the car door. Then the volunteer asks before assisting the client with her seatbelt. Volunteers can provide light assistance with balance, climbing stairs, or performing similar functions. In this next video, you'll notice that the volunteer first asks if she can provide assistance, then offers the client her arm.
Can I help you up the curb?
Yes.
At the client's request, volunteers may enter the exam room to serve as an advocate. They help the client remember questions to ask or ensure they leave with their discharge paperwork. Volunteers may not take notes or interpret medical information. Clients who have follow-up questions after their appointment should be directed back to their medical provider. Personal support means assisting clients with their coats, shoes, or boots. Some volunteers offer emotional or other personal support. If a client needs a higher level of physical support than the light support demonstrated in this session, please notify the volunteer supervisor. Sometimes older adults' conditions change rapidly, and their care consultant may not be aware of the changes. Part of the service volunteers provide is to be eyes and ears for SourcePoint's care consultants, that they may direct their clients to the services that best and most safely meet their needs. If a client cannot get out of a chair independently at a medical appointment, please ask for assistance from the medical staff. If a client needs heavy support, boosting, or lifting to get out of your car, please call 911 for assistance. There is no cost to the client for the squad to provide on-site assistance without transport to the hospital, but the potential cost to you or the client could be an injury or a fall. Play it safe and call 911. It may not seem like it when you are out on the road, but medical transportation volunteering is a team sport. The choices each volunteer makes creates expectations that the clients will want other volunteers to follow. By staying within these guidelines, service will be consistent no matter who is providing it. Please review the excellent video Disability Sensitivity Training located on the SourcePoint Volunteer Transportation Training page, and then you will have completed passenger support. Great job!